San Antonio researchers say they want to help parents spot and treat autism earlier.
They're working with a Harvard researcher on a project that could change the age they diagnose children from around 3 years old to just 3 months. Eyewitness News reporter Erica Zucco explains.
I visited Children's Hospital to get a first-hand look at the beginning stages of their project. In this room, play means more than shaking a rattle or looking through a book. It's also the name of a project launched by Children's Hospital of San Antonio, UTSA, and the Autism Treatment Center.
Kids who might be showing some early signs of autism might have some different ways of playing that aren't necessarily intuitive to the parents.
The researchers use new techniques to study brainwave data in infants and are developing a plan for parents to help them ID and treat symptoms.
A new way to identify children at risk as early as 3 months old. And that is just revolutionary, groundbreaking.
We're not looking for a cure for autism. We are just looking at ways to help parents have these positive social interactions with their infants and young toddlers.
Researchers will monitor kids' behavior as they play, everything from eye contact to interaction with family members and people they don't know. They'll see what stands out and develop training for parents on what to look for and how to respond.
Not only do we want to diagnose it early, but we want to change the outcome later on.
And researchers say they are still in the early stages of this project, but they're really hopeful about what their research could help them learn. Reporting from Children's Hospital, Erica Zucco, KENS 5 Eyewitness News.